First thing you want to do when taking blood pressure is ensure you have the correct cuff size. So you want to make sure that the width of the cuff, which is here on this wide end, covers at least 40% of the upper arm. And in this case it does. Next, you want to ensure that where the bladder's at, this portion here which you can feel, covers at least 80% of the upper arm. Which it does. Again, these are estimates to determine the correct cuff size, and you need to use your best judgment. To ensure correct placement of the cuff, first thing you want to do is you want to palpate the brachial artery to determine where that's at. And on your subject, what you can do is have them flex their bicep, and you're going to go medial to their bicipital tendon, and you should feel the brachial artery. Now, once you've located that, you'll grab the cuff and you'll read on the diaphragm side or the cuff side, this side against the limb. Okay, so ensure that this bladder is against the upper arm. Now, on the front of the cuffs, I'll have a side that shows where the artery should be at once you place the cuff. And for consistency, you want to make sure that the cuff is at least 1 to 2 centimeters above where the brachial artery is at. So a good rule of thumb is go off with 2 fingers from where it's at. Again, line up the line. Go around. You want to also ensure correct placement of the stethoscope. First thing you want to ensure is that you have the ear holes lined up in the correct facing direction. And in this case, you want them facing towards your ear canal when you stick them in. Next, you want to ensure that you have the correct bell that you want to use. On some of the cuffs, it only has 1 bell. On other cuffs, it has the bells for adults and infants. The way you ensure that you have the correct bell on for an adult is that you can flip it over, put the earplugs in, and you can lightly tap.
Okay, first thing, Tim put the blood pressure cuff on. Second, he puts the stethoscope in. He finds the brachial artery. Well, the stethoscope goes on there. And then he tightens up the valve. Then he begins pumping up the blood pressure cuff. Normally you're going to fill it up between 160 and 200 millimeters of mercury. Okay. So now Tim's at 200 millimeters of mercury. He slowly releases the valve. The needle on the blood pressure cup should only move 1 to 2 millimeters of mercury a second. A common mistake that most people make when first doing blood pressure is releasing the valve too quickly, and the needle goes all the way down to 0 before they can get a reading. The first lub-dub sound that you will hear is systolic blood pressure. Immediately after the last lub-dub sound will be diastolic. After that, release all the air out of the cuff.